Annyeonghaseyo! Good day everyone and welcome to my discussion. Today, we embark on a captivating exploration to my topic entitled Clinical Exercise Testing. By the way, I am Glero Sunsaga Nervasa and welcome to my discussion. The need of the hour is to understand the different methods used worldwide to assess the patient's and exercise performance and response in clinical practice. The question here is, what is clinical exercise testing?
Clinical exercise testing is an exercise test performed for the functional and prognostic evaluation of patients with heart disease or to help diagnose individuals with suspected heart disease. Clinical exercise testing is an increasingly gaining importance in clinical medicine by helping the clinician to objectively evaluate the psychological functions. The results helps to predict the outcome and mortality in different circumstances. Here are some examples of clinical exercise testing: 6 minutes walk test, treadmill exercise test, shuttle walk test, and cardiac stress test. 6 minutes walk test. The 6 minutes walk test is a practical simple test that can be done in an outpatient setting and requires no sophisticated exercise equipment or advanced training for clinicians. It's a test to assess functional capacity and helps to ascertain prognosis of your patient. It evaluates the global responses of all the systems involved during exercise, but it does not provide specific information about each of the different organs and systems involved during exercise. However, because most activities of daily living are performed at submaximal levels of exertion, the 6 minutes walk test may better reflect functional exercise level for daily physical activities. Treadmill stress test. A treadmill exercise test allows doctors to assess the response of the heart to the increased workload and demand for blood during exercise. This test helps diagnose, or this can be used to diagnose ischemic heart disease. Before the test, the doctor will first assess that you are medically fit for the test and obtain your consent for the test. The medical technologist will place the ECG electrodes on your chest and the blood pressure cuff around your arm. The medical technologist will guide you on how to walk on a treadmill before starting the test. The treadmill will start off slow and gradually increase its speed and slope incline in stages of 3 minutes intervals. There are a total of 7 stages. The higher stages are more strenuous. Shuttle walking test. It's measure the distance walked by a patient in a 10-meter course, being paced by an audio signals from a cassette. The intensity of exercise reached is comparable to tests performed on a treadmill, as the walking speed is progressively increased until the patient reaches exhaustion. Modification of maximal shuttle walk test for determination of endurance performance, similar to maximal and constant cycle ergometry, may be done. The last one is a cardiac stress test. It is a common type of exercise testing, the primary purpose of which is diagnosis and management of myocardial infarction. Bro's protocol is commonly used, and the single most reliable indication of ischemia is ST segment depression. During this test, ECG and BP is measured, but the utility may be enhanced by the concurrent measurement of ventilator parameters and respiratory gas exchange. Okay, so it is worth to know that the clinical insight gained from exercise testing can be improved by measurement of gas exchange variables, which are now readily obtained with user-friendly commercial metabolic system.
And that's the end of my discussion. I hope you have learned something on this topic. Thank you for watching.